Hello, everyone. Welcome to another One Mission DMD podcast conversations video. I'll be speaking with my good friend Sohaib, who's currently a D4 at ASDO, and we'll be talking all about dental school residencies. If you're tuning in here for the first time, this channel was created for anyone interested in a career in dentistry, no matter what part of the journey you may be at. So if you think you can benefit from that, please consider subscribing to the channel and liking this video for future content. So hey, welcome to the channel. Thank you so much for being here today with us.
Glad to be here, Ahmad.
So hey, tell us a little bit about yourself. What got you into dentistry and just where you're at today?
Yeah, so I'm a fourth-year student at the Arizona School of Dentistry, graduating in a few months. My story in dentistry is a little interesting. I was originally going on a pre-med track, and upon volunteering, I sort of realized that the patient care aspect wasn't really there for me. My dentist sort of pushed me into seeing what dentistry was all about. It combines my love of science and the quality of patient care that I want to give to my own patients. So it seemed like a best of both worlds kind of scenario, and that's how I got into dentistry.
So in this episode, we decided to talk all about dental school residencies. So do you think kind of give us a little bit of a breakdown in terms of how residencies are structured for dental students and if they're required, just a little bit of background for us?
Sure. So dental residencies are a little different than one may have heard about typical medical school residencies. Dental school residencies are not required after graduation. And you could actually complete a residency anytime after. You can work for 5-10 years and decide to apply for a residency, and that's completely fine. So it's structured a little bit differently in what people are typically used to seeing. There's around 9 or so dental residencies, each with their own deadlines. The main ones are sort of a 1-year dental school, post-dental school residency, an AEGD and GPR, which we'll talk about. And some are longer residencies, about 3 to 4 years, such as oral surgery, periodontist, or prosthodontist specialty.
Okay, cool. So how long do most of these residencies take, if you can kind of give us some information about that?
Yeah, sure. So the longest one would be the oral surgery residency. It takes around 4 years to complete, 4 to 6 years, depending on what program you do. And in descending order, prosthodontics and periodontics residencies typically take about 3 years or so. There's also a dental anesthesia residency that takes around the same time. Most students also do, if they're looking at residencies, also consider a GPR, which is a hospital-based residency, or an advanced education residency, which both take about a year to complete, generally with an optional second year as well. So as you can see, a lot of these residencies have varying timelines on completion and what you're interested in.
What part of dental school would you advise a dental student to start getting serious about it and kind of, having mentors in the process to be able to apply to these residencies successfully and land one?
That's a good question. So mainly people go into dental school, there's a range. People don't really know the different specialties. Some people may have had different experience with different specialties when they were volunteering. So my recommendation is that you really focus on your grades that first and second year. Towards the end of second year, going into clinic time, you've had a little bit of you've experienced a little bit of each residency through your curriculum and courses. So that gap between second and third year when you're entering clinic is really a good time to seriously consider a residency and start pursuing one if you'd like to. Now we can go into how you can kind of go in and get that experience. Some of that can be through dental externships. Some of that can be just through volunteering or spending time in your own specialty clinics in school, and a few other options to see if it really interests you, and go from there.
So hey, what would you say it takes to land an interview? Like, what can a dental student do to research the statistics and everything they need to kind of be at to be able to land one of these residencies?
So you definitely need a few things. My first recommendation would be to talk to the specialist at your school with the specialty that you're interested in. So talk to your school's endodontist, periodontist, prosthodontist, and so on, and really get a feel with what kind of things a school may be looking for. It's also vital that you let them know that you're interested, so you receive a good letter of recommendation from the specialty that you're applying to. My second recommendation would be to search online on forums such as Dental Town and SDN. You know, a lot of students do these interviews and they give their advice and what they've seen, and it gives a certain sort of perspective on what schools you may be interested in the future. Uh, and lastly, you should look at those schools that you're interested in and see what extra requirements that they may have or require of you. Some schools require other tests and extracurriculars that you may necessarily not know about. Some tests like the ADAT, some schools may have it as optional versus required. So these are the things that you kind of need to look for and give yourself ample time to study. Uh, for instance, for the oral surgery program, you sort of need to take a step one equivalent test to be considered. So it's important you search this in the beginning to middle of second year just to see if it's a route you want to pursue.
Wait, this is kind of a new topic where a lot of schools are implementing the pass fail model with their classes. So, how does that go with applying for residencies? How does that affect you as an applicant?
Yeah, and this is sort of a tricky question, and I'm sure you'll get different answers from different people. I can see this as sort of there are pros to it and there are cons to it. Uh, the pro is while these schools are looking at your application, you tend to be, a number. You were in the top 1% of your class with a 4.0 GPA. So that will, of course, help you stand out. But if you are at a pass fail system, it almost guarantees that they are looking at your application holistically. And while I'm sure they do that, the GPA is not such a big weight to your application because it is a pass fail. So that's the pro or con, whatever way you want to look at it. The other side is that if you do come from a school that may not necessarily have a reputation of being a top 10 or a top 15 school, um, they kind of they may look at this like, okay, that this might not necessarily work in your favor. So I wouldn't say it'd be a hindrance to you, but it does depend what the reputation of the school might take precedence if it is a pass fail system. I think ultimately it is a good call, specifically for our school or any school that you're applying to. If it is a pass fail, it's less pressure on getting the absolute best grade and really just focusing on the material. And now you do have to do a little bit of extra legwork where you have to set yourself apart from your other colleagues that will be applying to these residencies because a good portion of them will have their GPA to be considered. And when, let's say, someone doesn't, they do have to do other things to make themselves stand out and unique in the application process.
All right, so can you talk to us a little bit about the application process and how it works for whatever residency you're applying to?
So the main application is similar to your dental school application. Probably it's through the pass system, like into when you were originally applying to dental school. From the pass system, you can search for any school that's affiliated with that system, any specialty, deadlines, and it's really nice because it combines all of your applications onto one website. So you're not printing out 30 different letter of recommendations, sending out different transcripts. You're sending it to one major site. Now, it is important to note that not all systems utilize the pass system, so that's important. There are some schools and some specialties that aren't affiliated with that website, so it is imperative that you do your own research. And if a school is not a part of that system, you will need to probably do a completely separate application on that school's website. So just search for see if your school is affiliated or not. In regards to the application process, it's pretty straightforward. You need a certain number of letter recommendations. You need a recommendation from the dean. Essentially, that website sends off an application straight to your school. It's all digitized. It's all extremely simple. Um, what's important to note is that your specialty falls on a different deadline than other specialties. There's a phase one and a phase two of pass applications. And we could talk about that a little bit later on what to expect when you're going through the application. Um, just note that if you're applying for an AEGD, you might have a different deadline for a different school than if you're applying for an ortho program. So it's important to note your school's deadlines and to act accordingly. As for the process, the application process, very simple, very streamlined. They ask for your research, awards, academics, and compile it into one website. And if any school has any supplemental applications, that's also on the website. So very straightforward and very easy to use.
Okay, so I understand how you said each place has their own deadline, but is that specialty based that they have a deadline, or is like one's ortho deadline different from another school's ortho deadline? Okay, so regarding match, I know with medical schools, like they find out on a specific day, streamlined across the board when they get in and if they got a residency. How does it work with dental school, like with pre and post match? Can you explain a little bit about that?
Yeah, so dental school is a little bit more complicated in that there's actually um, three different sort of ways a school can offer an acceptance. Um, there are schools that do not participate in match. And just to let the viewers know, match is a system where, like into medical residencies, um, every student finds out on the same day whether they were accepted in a residency or not. So it's sort of a rank list. You rank the school, and the school ranks you on their list, and they run it through sort of a program, and it spits out a number. And if you rank each other, sort of like a relationship or something, if you rank each other, you both chose each other, and you have officially accepted that school's invite to attend their residency. That's what matches. Some schools don't participate in match, so they may offer an acceptance before the match deadline, and it's sort of a catch 22 because a school may offer you an acceptance 2 months before with the 2 months before match with the condition that you have to withdraw all of your match applications. So it's sort of like it's a school might try to undercut another school, and it's not to say, I'm not trying to say that it's, it is a competitive there is a competitiveness to a lot of these residencies, but a school may really like you and they don't participate in a match and they really want you, so they'll say, hey, listen, this invitation is yours with the condition that you are coming here, so you'd have to withdraw your other applications. So that's what a non-match school is. They generally have a deadline before the match schools give their rankings. And then, like I said, there's match, so everyone finds out that same day. And there is a period after match, sort of like about a month or a few weeks after match, where there are certain schools that may need extra students since the algorithm didn't match them with enough students. So, UCLA might have one extra spot in their AEGD program, and they open it up to something called a post match. So anyone can apply to that post match, even if you didn't apply in earlier rounds. Obviously, some schools have different rules for that, but you can apply to a school post match and they try to fill in that spot in the subsequent weeks. So those are the um, three ways a school can offer an invitation.
So you spoke a little bit about AEGDs, and the common question that dental students have is, what is the difference between an AEGD and a GPR? If you can kind of give us some information about that.
A GPR tends to be sort of a hospital based residency where you're combining your dental clinic with other skills. So you may be on call in the OR. You're sort of a dental specialist in a hospital. So you'll participate in sedations. You'll be on call for any sort of head and neck issues that the ER can page you through. You may suit up for surgeries that may not necessarily apply that may not necessarily apply to a specific dental education. You're kind of getting a holistic education. GPRs are mainly for those who really want to treat medically complex and special needs patients, as well as pediatric population as well. Generally, those subpopulations that may not always receive the highest quality care, there is sort of a uh, those three groups don't receive as much care as they should. So GPRs really target the medically complex and geriatric population groups. They're a great option for anyone who wants to pursue a hospital dentistry and wants to make sure they cover all of the groups that they can take care of. There's VAs, there's school affiliated GPRs. Generally, though, it is a hospital based residency versus an AEGD where it's a dental clinic residency. You're really focusing on getting more complex skills such as molar endo and implants and etc. And you're mainly people liken an AEGD to a private practice setting where you're really focusing on speed. Um, Nowadays, in the past decade or so, I'd say that the lines have become sort of blurred. A lot of GPRs offer, right off the bat, complex procedures as well. They offer, for instance, the VA offers implants, full mouth rehabilitation, and so on. Sort of the complex procedures that AEGD residencies tend to do. So the lines have definitely blurred a little bit in what a GPR and an AEGD stand for. It's not like one residency is here, the other is here. It's sort of like a Venn diagram where there can be GPRs that act like AGDs and vice versa. So it's really important to really look into the program that you're interested in and see where on that spectrum your program lies.
So, how does compensation come into play? Is like only one of the two where you can kind of get paid for the residency, or is it just depending on where you're applying?
That's a great question. And I'm actually going to open this up to all the specialties that you can apply to. Specifically, just for GPRs, though, most hospital based residencies give you some sort of stipend or compensation. Now, it would be a resident salary, ranges around 40 to 50,000 for that year. Um, when you get to the school side of things, so AEGDs and Perio and PROS programs affiliated with schools, um, a lot of them may not necessarily give you a stipend, or they might give you a stipend but also charge you tuition. So it's a very program by program basis. Um, there are some programs that you'll need to pay an extra five figures or so to attend that school, even with your stipend. So from what I've seen, most hospital based residencies tend to give you a stipend and you're net positive on that. So you're not paying any sort of tuition. That's why a lot of people, VAs are a very popular GPR residency program to apply to. You get a decent stipend as well as great complex procedures since most of the dental care is covered for veterans.
So, this stipend that you're referring to for GPRs, is this like something that you're getting through loans? I'm assuming, right? Just like with dental school and undergrad?
No, actually, these stipends are paid out, so it's as if you're working for them. So you will get a W-2 and the whole shebang later down the road. You are getting paid by them. Now, it is a school by school basis. I'm not familiar with schools that charge tuition and give you a stipend. If you're considered to be working for them, I'd assume not. But there are schools that give you a stipend, no questions asked. There are schools that charge tuition and give you a stipend, and there's just some schools that they you need to pay tuition to attend that dental residency. So it's definitely important to do your due diligence.
Okay. So, after kind of researching and talking to you about these things, who would you advise as a dental student to consider looking into a residency? And who would you think should avoid looking into residencies?
That's a tough question. So it's definitely a case by case basis. Probably by years 2 and 3, you tend to know what you like and what you don't like. You tend to gravitate towards a program, whether it's oral surgery or pros or perio. Um, what you can do is, if you're not sure about whether a specialty is for you, or let's say you're interested in oral surgery but you're not sure if you want to complete the extra 4 to 6 years, my recommendation would be to apply for externships. And externships are 1 week programs where you sort of visit a school's residency, and you shadow them and you see the types of procedures that they do. So that's a great option if you're on the fence of completing a residency or not for the other specialties. As for an AEGD GPR, it really depends on how. The old saying was, if you're not confident coming out of dental school, do an AEGD or GPR. Uh, that's changed in recent years. An AEGD GPR is a great stepping stone for getting these complex procedures in a short amount of time. Now, of course, that's on a school by school basis. There are some schools that are excellent in giving you implant experience, molar endo experience, and these other experiences that you may not receive in dental school. So, my recommendation is, if you want to sort of take a pay cut following your first year and really get a handle of these possibly more complex procedures, or if you're just not feeling confident after dental school, an AGD GPR can be a great tool to have. Um, the good thing is, if you don't think a residency is right for you, if you're on the fence, it's you could always work for the first few years and always apply to a residency a few years after working. There's nothing wrong with that, and that's what sort of distinguishes us from a medical school residency where you have to do a residency after. It's completely okay, and a few of my friends have worked for a few years and they've applied to a GPR or a PROS program few years after working. There's nothing wrong with that. So, to answer your question, it definitely is a case by case basis, but you really have to reflect on yourself on what kind of dentist do you want to be. Do you want to be a sort of jack of all trades, or do you want to focus on a specific path in dentistry? And we'll leave it at that in terms of if you'd be interested in applying or not.
So, how did residency interviews kind of take place with COVID going on? I know with dental school applications, people had a lot of stuff online and whatnot. How did it go down for residencies exactly?
Yeah, that's a good question. It was definitely very different than what the norm is. These online residency interviews took about 30 minutes to an hour and a half, versus you visiting the school for 8 hours a day. You go through their clinic, you walk through their facilities, you talk to residents, admissions coordinators, you go out for dinner. It's a completely different dynamic. You have a shortened period of time in that 1 hour to really make an impression. And it's difficult because you're ranking these residencies sort of blind, because you have a 30-minute interview with the residents, a 30-minute interview with the admissions committee. It's very difficult to ascertain what kind of program or what kind of culture you're dealing with, since you're not there visiting the campus for an extended period of time. So that was the experience that I had. It was nice because travel costs are down. You're really focused for that 1 hour. But I think most people would much rather prefer visiting the school, since you're asked to make a big time commitment to go to the school for a year to 4 years. So you really want to see how that dynamic is. My recommendation would be, if things haven't changed in the next interview cycle, to contact former residents that went to that school, um, and ask them these questions and see if you could apply for an externship to a specific school if you're interested in that specific program. But really contact program directors and admission directors early on, because I don't know if that 1 hour interview is enough to really figure out what a program is.
All right, so well, do you have any final closing remarks or advice for anyone looking into apply to a dental school residency?
So the good thing is you're at the deadline. If you're at this point in your career and watching this interview, you're just about to be finished with dental school, and it could be a confusing time. You're worried about whether going to a residency or applying for a community health center or corporate or private practice. There's so many options when exiting dental school that it's kind of you can kind of get overwhelmed. Uh, the good thing is what my remarks would be is take a step back and really realize the situation you're in. You're graduating school and you have so many paths in front of you. And just like applying for dental school, you may think about a path that you're seeing in the future that you're going to go to XYZ school or you'll be doing XYZ residency. And that may not necessarily pan out. So, really take a step back and look towards the opportunities that you have in the future. And if residency doesn't work out, it's not the end of the world. You still have options down the road where you can work a few years and you may grow to just love working. And you may not necessarily do a residency in the future after you work for a few years. So, take a step back and there's multiple paths out there for you to take. And it may not be the one that you've thought of since entering dental school. And if anyone on this stream or podcast, you can reach out to me anytime if you're interested in applying for AEGD GPRs. It's always good to have someone who went through the experience just to reach out and talk to how their experience was. So, thanks for having me, Taham. I really appreciate it.
Of course, yeah, and I'll definitely put your contact information in the description of the video. And thank you so much for sitting down with us and just answering all of these questions because it's literally on everyone's mind and they don't know who to ask. So I really appreciate it, Sohaib. Thank you so much.
Definitely. Anytime. Thanks for having me.
All right, man. Take care.